Good evening, my name is Ari. Today I will present my critical appraisal of one research in e-health area. First of all, I would like to apologize because I cannot present it directly to you due to my circumstances. I appraised one article by Liang et al. The title is Effect of Mobile Phone Intervention for Diabetes on Glycemic Control, a Meta-Analysis. There are two reasons why I choose this article. The first, as we know that chronic disease is a global health problem and diabetes is one of the chronic disease. It's not only affected developed country but also become emerging problem in developing countries. And we also know that in developing countries, access to healthcare is still questionable. The access is very limited. The second reason is due to the chronic disease nature, diabetes patients will need continuous treatment and monitoring of their blood glucose level to prevent severe complications and achieve their prime well-being. Therefore, an innovative intervention that can provide access to proper health care and allow diabetes patients to self-manage their condition will bring benefit for them. Telemedicine has been proposed to support this patient, and mobile phone is one of technology that been piloted due to their wide acceptance within the community. What the research was about, the aim of this study was to assess the effectiveness of mobile phone intervention for glycemic control in diabetes patients. The research design for this study is meta-analysis with quantitative analysis. The author analyzed 22 English language studies related to the use of mobile phone in supporting the management of diabetes and using the reduction of HbA1c level as the outcome. HbA1c is a laboratory test that shows the average level of blood sugar or glucose over the previous 3 months. It shows how well you are controlling your diabetes. The author pooled 1,657 patients from 22 studies and performed statistical analysis to see the impact of mobile phone intervention on the reduction of HbA1c level. And findings from these studies there were 3 characteristics of mobile phone intervention in these studies. The first one, using combination of short message or SMS and internet. The second, only rely on SMS. The third, combination of SMS and clinical visit from diabetes specialist nurse. The content of mobile phone intervention is diverse, from encouragement of self-monitored blood glucose level, combined with drug adjustment, lifestyle management, and education intervention. The result of the study that the mobile phone intervention is proven statistically significant in controlling glycemic level by reducing HbA1c level in diabetes patients. The appraisal of this study are based on the systemic review appraisal checklist from CASP tools. Overall, this study performed a rigor meta-analysis. The strength of this study, the study has a clear research question underlying the use of well-known journal databases such as PubMed, Embase, and Cochrane. And this study analyzed appropriate studies with high-quality study design. The author only reviewed randomized control trial, randomized crossover trial, and control before and after trial. They exclude case study, cohort study, case control study, and other studies. The author also considered the quality of all the reviewed studies thoroughly. They rank the study based on the randomization process, inclusion criteria, and sample size calculation. The statistical result presented in the proper way to present a randomized control trial result. In this case, the difference of HbA1c reduction between intervention and control group. The limitation of these studies, the possibility of publication bias, because they exclude non-English language studies, and if they only use English study, they may overlook other study in the same area but using other language than English. And there are possibilities that study that may have no effect are not published. Therefore, it can bias the result. The result of this study also influenced by the limitation of the reviewed studies, such as selection bias and small sample size. Further research with careful design to prevent biases, larger sample size, and longer time frame will show a better result. Finally, this meta-analysis provide useful insight on the effectiveness of mobile phone in supporting patients achieving their prime health. And as in developing countries, this can be a useful tools to make sure access for healthcare for the diabetes patients. And thank you for your attention.